Contact tracing is the process by which, during an outbreak of anything, um, public health teams or officials, doctors, nurses, health inspectors, basically start to interview the ill person or the person with the condition and start to get from them what we call a contact trace. So first of all, you try to get their contacts, who have you been around, and so on. And then you try to give a trace. So the trace time or duration depends on the illness you're dealing with. If you have an illness that has an incubation period of 2 days or something like that, then you don't have to necessarily trace too far. Some illnesses have much longer incubation periods, and they would require what we call a much longer trace. In theory, or at least just in the basics, contact tracing can be easy when you think of it, but it also can be difficult and challenging, and requires you to ask questions multiple different ways, and requires you to find ways to jog people's memories. So what we would do, first of all, if somebody is positive, the first thing that occurs is what's called a notification. So someone from the Ministry of Health would call the person whose result has come up as positive and let them know basically that they are positive, and then refer that person so that the person can be transported to isolation. At that point, some basic contact tracing information is gathered. Who's in the house, where they work, phone numbers, and so on. Sometimes the person doing the notifying is also the person's contact tracer. Sometimes the person doing the notifying is just doing the notifying and then handing over the case to somebody to actually contact trace. The contact tracing is normally done by the medical officer of health or their team from the catchment that person lives in, unless the person is already obviously part of a cluster and you might have a team or an individual doing the tracing for a cluster. And if that is the case, then you might get someone doing the tracing who's not from that area. So the tracing starts off with basic demographic stuff, name, age, that sort of stuff. Again, you're trying to make sure that the person you're talking to is indeed the person with the positive result. And then you get an idea as to who's in the household, who their primary contacts are. And what is a primary contact? A primary contact is someone who has been in close contact with the positive person, right? And the WHO and PAHO do have definitions for that as well, which we can get to a bit after. And it's not just working out, well, John has been around Carol and Philip and Henry. You also have to find out what level of risk that interaction was. So when John was around Henry, were they wearing masks? What sort of masks? What were they doing? What was the location? What was the activity? And that can also determine whether somebody is a primary contact and whether they need to do things like get tested or quarantine and so on. And that is also very important later on. The other thing we start to look at is try to identify as soon as we can who secondary contacts might be. So secondary contacts would be people who are contacts of the primary contacts. So maybe Henry was a primary contact because he was working with John close in the office and they weren't wearing masks. Henry's brother, who happens to live in the same house as Henry, would be a secondary contact, right? And any of Henry's brother's friends might be tertiary contacts, and you go on and on like that. At the beginning, obviously, we are only really concerned about the primary contacts because those are the people who would need to be quarantined, and those are the people who would need to be tested. The tracing also involves a day-to-day, ball-by-ball, play-by-play as to what the person has done. So again, depending on the illness you're going back, and how far you go back depends on the illness and the circumstance. So for COVID, you're talking going back 10, 14 days, unless the person is a traveler, in which you only go back to the day that they arrived. And you just go back bit by bit. Such and such a day, what did you do? You got up, you did this, you did that, you went here, you went there. And each time you work out where they've been or what they've done, you again try to assess what sort of interaction there's been. And I know that some questions might be coming to Dr. Best with regards to businesses, but that's where it then becomes important as to whether a business should close or not close. Because somebody might work somewhere, but they might not interact with all the people who work there, right? Somebody might work upstairs and only in the time that was important interacted with 3 employees, meaning that all the other employees are secondary contacts or tertiary contacts. And it's only really then the primary contacts who would need to quarantine and get tested. And then depending on your business might be able to stay open and function without those primary contacts being present, right? And not necessarily have to blanket close down. So contact tracing is very important as well in that sense. It can be difficult because, as I said, you have to jog people's memories, depending on how far back you go. People tend to remember things in spurts. Today they tell you, oh, yesterday I didn't go anywhere, I just stayed home. And then a little while later, then they come and say, oh, oops, I forgot, I actually went to the shop, or I went to the gas station. Or they say I went a particular place and I interacted with no one, I had on my mask the whole time and so on. And then a little later they remember that they saw a friend that they hadn't seen since school days, and they told them hello and gave them a hug, or some story like that then comes up, which can make contact tracing difficult. One of the things that also makes it challenging is occasionally you get individuals who, it's not a lack of memory, but it's that you have individuals who might not want to be forthcoming with the truth. Sometimes people are not supposed to be certain places, right? Because of work and other reasons. And they might try to hold it back, right? We had this issue with the bus crawl. One of the individuals who was involved in the bus crawl, for example, initially had told mentioned nothing about it whatsoever to the persons doing the contact trace at first. And as we would tend to say, then sometimes little birdies tell you things. And somebody then pinpointed that this person was there. And then when they were asked again, then they freed up the information. Early in Barbados' journey with COVID, we had a gentleman who had a paramour that his family didn't approve of, and he insisted that he had not been around anybody. And it was only again by diligent contact tracing that one of the contact tracers kept hearing a name pop up, and when they called the person, she then let it all out. And in the end, that person was positive, and that person was actually the source from that guy's COVID infection. So contact tracing can be difficult, it can be challenging. It can be rewarding when you get all the numbers and everything seems to fit together and you can link clusters and so on.